Today, I want to talk about the sensations, the special senses of sight and hearing on our medical terminology review with A&P concepts. So, some diseases that are likely to be associated with our sense of sight include strabismus. Strabismus is going to be cross eyes. Okay, people may have heard the term cross eyes. That is due, in many cases, due to the muscles of the eye, and there are three different sets of muscles that give movement to the actual eyeball. That may be due to the muscles allowing the eyes to cross and interfere with someone's visual eye pattern. Amblyopia, which is lazy eye. Again, it deals with something that affects our vision, and in this case, what happens is there's a disconnect between the eye and the brain in terms of being able to pick up information from one eye more precisely and fully than the other eye. The next term, myopia, means nearsightedness. Nearsightedness. You can see things close up, but you can't see them far away, in contrast with the next term, hyperopia. In this case, you can see objects that are a ways off. This is farsightedness. Now, presbyopia. Presbyopia is age-related loss of vision, and typically a person with presbyopia will have trouble seeing things that are close up, but be able to have good vision at a distance. In other words, farsightedness. And you oftentimes see them trying to stretch their arms out when they're reading to look at something on paper to be able to get it to where they can actually see it. Up close, at reading distance, the normal reading distance, they just can't make it out. The next term is glaucoma. Now, glaucoma is a disease related to the pressure in the eye. And in the field, this pressure gets tested with a device called a tonometer, and that gives the optometrist or ophthalmologist the information that they need to make recommendations for how the glaucoma is going to be treated. And then finally, cataracts. Cataracts are an opaque clouding of the eyes, and oftentimes that leads to a surgical process that needs to be taken care of to get rid of that opaque covering over the eye. Now, with our sense of hearing, some very common diseases associated with hearing include otitis externa, otitis media, and otitis interna, or labyrinthitis. Oto, of course, means ear. Itis means inflammation. So externa, otitis externa, would be inflammation of the auditory canal between the pinna, which is the ear that we think of, the outer part of the ear, and up to the tympanic membrane. Okay, all of that is considered the external ear. Then otitis media would be from the middle part of the ear that consists of the auditory ossicles up until we get into the area that contains the cochlea and the labyrinths, the inner ear. Okay, and then otitis interna or labyrinthitis, that's the innermost part of the ear, where the cochlea is located, where the labyrinths are located. Of course, the ear serves the dual purpose of hearing through the cochlea and ultimately the cochlear nerve, and also the vestibular portion, which gives us our position in space, the labyrinths or the semicircular canals, which ultimately feed back information to the brain to give us where we're located, to keep our head up and our feet planted firmly on the ground, so we've got good footing, so we're on balance. Now, tinnitus is going to be a problem with a continual ringing in the ear. Some people with tinnitus will actually have an issue with bone conduction. Remember, in the inner ear, we have the 3 tiny auditory ossicles. They are the malleus, which is the mallet, which is right up against the tympanic membrane. And when the tympanic membrane vibrates because of sound waves hitting it, that in turn causes the malleus to pound on the incus. Another name for the incus is the anvil. And then that anvil in turn pulls on the stapes. Stapes, another term for it, is the stirrup. And so when that stirrup gets pulled upon, that leads to ripples being created in the fluid in the inner ear, and that information gets picked up by the cochlear nerve and transmitted back to the temporal lobe of the brain. Well, tinnitus for most people, though, is a difference between sensation and perception. Sensation is the information that our special senses pick up from the environment. We have our tactile sensation, okay, in other words, our hands. And our hands pick up different objects because of all of the many receptors in our integument that allow us to manipulate things in our environment due to our sensation of touch. We also have the sensation of sight, which gives us the ability to pick up visual information. We have the sensation, special sense of smell, which is called olfaction. We have the special sense of taste, which is gustation. We have the auditory sensation of hearing. Okay? Now, sensation is the information that we get from the environment, but ultimately that information is carried by nerves to the central nervous system. And of course, the ultimate processing center of the central nervous system is our cerebrum, our supercomputer. And that supercomputer then takes that information and makes something out of it. In other words, perception. If we happen to hear a jackhammer hitting a road plate, okay, if we've ever heard that noise before and had the ability to make the distinction of what that noise sounds like, then we can get that perception from hearing it again. It kind of creates a picture in our mind of a construction worker holding a jackhammer and causing it to hit a road plate. Okay? But people with tinnitus most of the time don't have an issue with bone connection, but they perceive at all times to be hearing something. There's an issue in the temporal lobe of the brain that causes them to have this continual ringing in the ear. So it's a problem between sensation, the fact that there is no actual information being picked up that would lead to the perception that there is a ringing noise going on at that particular time. Okay? Many times people with tinnitus will be given a device called a white noise machine, and the noise machine helps drown out that continual ringing in the patient's ears. Okay? But these are some terms associated with two of our special senses, sight and hearing, and some diseases that we commonly see linked to these special senses.